All right, Dr. Fuhrman, thank you so much for being a guest today on the Holistic Hub podcast. I'm really excited to dive into all things longevity with you.
Thanks so much for having me. I'm so excited to chat with you too.
Aw. Well, it was so fun because we met at at that farm dinner a few months ago, and we happened to sit across from each other, and it was just fun kind of getting to know you, and I know we've been following each other on social and stuff, but just kind of exciting to see what you were in the works in creating with your family. And so I'd love to just kind of get started in hearing what's your journey into all of this, into nutrition, into supporting people with longevity and breast cancer awareness and nutrition and everything. I'd just love to hear your story as well as what led you to creating Longevity RX.
Mm-hmm. Yeah, I loved meeting you two at the farm dinner, and it's so fun to bridge the gap between social media and in person, because we love that community we can build on social media, but it's so nice to actually meet people in person and have that interaction. It's just great. So that was fun.
For sure.
And my, introduction into nutrition and to medicine was really when I was born, straight from the womb. I grew up immersed in nutritional science, and my dad, Dr. Joel Fuhrman, is a 7 times New York Times bestselling author. He's had 5 PBS television shows. He's very, very passionate about nutrition and has spent decades researching how nutrient-dense diets can prevent and even reverse disease. So food as medicine wasn't really a concept to me. It was just normal life. And it's always been a big deal in my house. Growing up, my dad talked about it all the time. And I would say we had mini lectures every day. He would come home, about a new research article. If he learned that there's flavones in the citrus peels of kumquats and oranges and lemons, he would share that with us as kids.
That's amazing.
We were 10 years old, and he would give us that information saying this is why we eat healthy. And not only because it's good for your body, but because I love you and I want you to live a long, healthy life. So it was really a health seminar in my home every single day, which is great. And it was great, but it wasn't always easy. And my dad and I actually always laugh because out of all of my siblings, I'm one of 4, and I was the most rebellious. So the fact that
and now you work alongside him.
Yeah. And then now I work alongside him. It's just so funny to look back on that because, of course, it was an act of love of him teaching us about nutrition, but there were a lot of moments when we wanted a birthday cake at a friend's house, and my dad, gave us some kickback on that. And looking back, I think through those tough times growing up, I came out stronger, and I did have my own, going to friends' houses to cheat, health issues. I had really bad acne growing up, and my dad said, if you ate the way I told you to, you wouldn't have acne. So the vain high schooler was I'm going to try this, I'm going to do what he says, and I'm going to get rid of my acne. And so that really shaped me in a lasting way to go through something on my own and feel the benefits after changing my diet. And when I say changing my diet, I still ate healthy at home. I was just more of the I'm going to have broccoli for dinner, and then I'll sometimes when I'm out with friends, do whatever I want. So making those little changes really helped me. And then fast forward to later in life, I was working in finance after college, and it was boring. And, entry level salary, not the best. I could barely afford to live. And so I asked my parents for a side job to make extra money. And they gave me the task of scribing my dad's lectures. And in that moment, I was, taken back to the little me who my dad had he would have a fasting house where people would come to our house or a local house nearby, and he would supervise them in their health. And so I thought of all those people and how I watched them get so much better. And then I was also scribing these lectures where I was oh my gosh, now this is the science behind why those people got better. And I just found it so fascinating and knew that I wanted to be a part of that mission in helping people. So I decided to pursue my training as a naturopathic doctor. And I realized something super important, which is that even though the science is strong, many people are never given the tools or the option, really. Doctors don't give people options on do you want to reverse your disease through diet and lifestyle, or do you want me to give you a medication to mask your symptom? They just do one because that they think the patient will like. And so much of medicine is driven by trends and accessibility and a lot of misinformation. So it's rare that patients are empowered to reverse their conditions through nutrition. And I got to see that firsthand as a child, but it's so much more miraculous now that I'm older.
Oh, that's amazing. You know, that you touched on something like so like near and dear to my heart, like talking about the empowerment piece, because I truly believe like that awareness and empowerment is like the biggest and overarching, most important first step in like getting people better, like from whatever they might be dealing with. Because like if we can't understand and then empower ourselves with the fact that we can heal, like by just like taking a supplement or taking a medication or doing this or that, like following blindly, like how can we actually like follow through like with our own health? And so that's really amazing story, really cool to hear, and would love to hear a little bit more about the center that you guys just opened recently, Longevity RX in Rancho Santa Fe, California, right?
Yes, yeah. Rancho Santa Fe is in San Diego. It's like just another name in San Diego, but it's really close to all of San Diego. So it's been awesome. And we've been open for, about a month and a half almost.
Cool.
And I've been seeing patients before we opened, doing a lot of like patient care at a separate location in telehealth. So it was nice to see patients even before we opened and get the experience with my dad. But just as you said, like one thing you love about healthcare and working in this field is empowering patients. And that's where I think Longevity RX really, makes like it's different from other places, because I'm able to bridge a gap between longevity medicine and advanced diagnostics, and combining that with nutrition and data-driven testing is the best way to help people live longer. And I find that having these screening tools that we have at Longevity RX with advanced testing and different machines, some of our machines even came from Europe, it's been so awesome to watch people's motivation just go up. And when I show them their numbers on actual paper, like I have a really cool scanner here. It's called a carotenoid scanner, and it picks up the pigment in your skin to see how many antioxidants like fruits and vegetables you eat. And I like to joke around and call it the fruit and vegetable lie detector test, because people will tell me they're eating really well, and then I can do that scan with them and show them their numbers, and then, we can find the gaps in their diet. But it's really used as motivation for the patient. And I think that the main difference in my approach is that I genuinely believe in my patient's ability to make miraculous recoveries through through the health conditions that they're facing, even including cancer. And I just seen the body do extraordinary things when given the right tools.
Yeah.
I think it's so cool that in order to, live your longest life and increase longevity and health span, that we rely so much on the earth. And what we eat comes from the earth, and it's so grounding and like eye-opening, and feels so good to rely on our environment, for hikes and exercise, for fruits and vegetables that come from the earth. I just think it's so cool, and that's such a big part of what we do. So.
Wow, I love it. So can you dive a little bit deep into like what the nutritarian approach is and like what that means? Because that's something that you kind of display on your website. I know that's what you and your dad talk about. And so can you kind of describe that approach just like a little bit more for the listeners so they understand?
Yeah, that's a great question, because we spend, with my initial consult, the first visit, it's at least an hour, because it takes so long to go over these dietary principles, and the nutritarian diet is a big one. So I love sharing this with people. And it really means that we center our diet on maximizing nutrients per calorie. And one of the principles of a nutritarian diet is moderate caloric restriction in the context of micronutrient excellence. And what that means is we're eating foods that prevent you from getting disease, prevent you from getting cancer, and promote longevity. We have a really fun acronym called GBOMS, and those are the healthiest foods to eat every day. That's greens, beans, onions, mushrooms, berries, and seeds. And then at the same time, we're minimizing foods that promote inflammation and oxidative stress. I always share with my patients that there's 4 pillars to longevity and eating this way. And the first pillar is nutrient density in the tissues. So that's again what I was talking about with how many nutrients per calorie you're eating. Something like kale has a lot of nutrients and low calories. Something like an oil has practically no nutrients and a lot of calories. So we're minimizing those oils and we're eating a lot of the things like broccoli and kale and bok choy. And the second pillar is toxicity in the tissues. So we always talk about how to reduce toxins and what that looks like for an individual patient. We can also see that on advanced blood work, which is really cool. But as your nutrients go up, your toxins go down. The third one is body fat percent. So for a male, we do an in-body in all of our patients. And for a male, we want the body fat percent to be less than 15. And for a female, that would be less than 25. And then the fourth one is your omega-3 index. And that's really important because not only does it prevent you from getting dementia in older age or something like Parkinson's disease, but it also helps your body detox properly. And without having your omega-3 index be in the proper range, you can't detox properly. So that's kind of the basis of the nutritarian approach, looking at diet and toxins. And I do discuss this with every patient, but it is personalized. And not everyone starts in the same place, because sustainability really matters. And I want people to really understand that this is not a short-term solution for a condition. It's a lifelong framework that reduces your disease risk and slows biological aging so that you can be hanging out with your grandkids when you're in your 90s and enjoying life all the way until the end and really increase our health span, not just our lifespan.
I love that. Something that I want to highlight that you talked about was talking about like nutrient density and how that can reduce toxicity. And again, like it's just bringing it back. I was just talking about this with a client yesterday, like the foundational approaches to supporting the body through whatever it is that we're going through that's creating inflammation really boils down to like what we're kind of doing like day in and day out that we can make like these like lifelong habits. And that nutrition piece is like so key and so important, because if we're deficient in omega-3s, certain amino acids, certain nutrients, the list goes on. Like, how can it support our body's ability to fight whatever stressor is going on? How can we have the possible like B vitamins and all these necessary nutrients to support liver detoxification and everything? So, I mean, I love that that's like such a foundational approach for you guys. And I think that's just like, I just wanted to highlight that because that's like such an important piece. I think that every practitioner needs to be doing like as part of their toolbox, essentially, to help people.
Absolutely. And it's sad that we don't really learn the science-backed information in med school. Even in naturopathic med school, the nutrition education was really lacking, and it went off of trends, not the research that's out there. And the research is so strong. We do a lot of research at Longevity RX. Like my dad and I both know how to do research and really look at that. But we also have a full-time PhD nutritional researcher on our team that works for us full-time, making sure that we're really up to date on all the research that's coming out. And one thing I've really like admired from my dad and his career is that if research comes out that maybe contradicted something he said in the past or maybe elaborated on something he said in the past, he's always changing his thought process and methods based on the research, not saying like, oh, I said that 10 years ago, so I'm going to go with what I said 10 years ago, right?
Yeah, it's so important to be like ever evolving, basically, because like, we have some information that we had 10, 20, 30 years ago, but things can change. And that's what the beauty of research is to be able to uncover those truths and then be able to adapt to that and use that like moving forward with people. So no, I love that. That's so cool that you have a PhD like support to be able to help with the research and provide like all that up-to-date information too, so that you can better like serve your patients. So that being said, I'd love to kind of dive into then like some of the more like common, I guess, conditions that you guys are working with at Longevity RX, and, talking off air with you, something that I wasn't planning on bringing up today, but now I'm so happy you brought up, was talking about breast cancer and how this is something that you're very passionate about and helping people, because you were talking about how it can be like, there's these steps that we can take to help support these women that are going through this. So I'd love to talk about what your approach is to that, the screening tool it is that you're using to help identify like what's going on. And then, some of the recommendations that you might be making. Again, I know everything is very individualized, but would just love to kind of hear like an overarching view of what you're doing with patients.
Yeah, of course. So with breast cancer, I think specifically what's really important to understand is overdiagnosis first off. And I always knew that I would see patients virtually, or, I wanted to be a part of my family's online business, but I never knew I was going to have a brick and mortar, like actual medical office.
Yeah.
And the reason I opened is because I learned about a machine called QT imaging. And what it does is it helps reduce overdiagnosis. So to understand that is when you look at, there's a Cochrane review, which is a company that does research with no outside affiliations. So they're not affiliated with any sort of like screening technology like mammogram, MRI, or hospitals or anything like that. And they've found about a 30% rate of overdiagnosis, which shows you that conventional screening methods are doing more harm than good because you're treating people that don't need to be treated for breast cancer. And the breast cancer treatments put people in early menopause. If they're not in menopause, if it's not a postmenopausal breast cancer, the treatment can put you in early menopause, causing anxiety, fatigue, brain fog, as well as, low libido, vaginal dryness, just like a slew of symptoms. And they also increase your risk of cardiovascular disease, which is one of the leading causes of death in females. So it's just going down this role of the diagnosis making you a forever patient in medical care. And that's on top of all the mental gymnastics that comes with a cancer diagnosis, right? No one wants to have a cancer diagnosis. So the 30% rate of overdiagnosis is just detrimental to society. And the reason that that's happening is because with a mammogram or an MRI, if you see something abnormal, you are actually sent to biopsy. No matter if they think what's abnormal is something that's benign and never going to harm you, or if it's something aggressive and going to harm you. So when you're sent for biopsy, if they see something's abnormal with the tissues that they're looking at under the microscope, they're looking at dead tissue. You can't tell on this tissue if something is abnormal, going to be aggressive, going to harm you, you should get treatment. Or if it's something that's benign, does not need treatment, is never going to harm you. About 50% of females die of other causes with a breast cancer on autopsy. And that's because there are types of breast cancer that will never harm you. There are abnormalities in the breast that will never cause your life to be shortened. And so with that being said, why QT imaging is such an amazing technology is because you can measure something called lesion doubling time. So what that means is that if you have a cancer, it's going to double in size within a certain amount of time. The average is about 120 days. So with QT imaging, there's no radiation, no compression. It's very comfortable for the patient. So you can repeat a QT scan in about 4 to 6 months and see if a lesion has doubled in size. And that's a much more accurate predictor than going for biopsy to see if you have an aggressive mass. Wow. And what's so cool about QT also with the no radiation, no compression is that it takes an image that's 40 times more clear than an MRI and 20 times the resolution of a mammogram without the radiation, without the compression. MRIs use a heavy metal called gadolinium in their screenings. There's no gadolinium. It's really cool. And there's actually 248 cameras in the receiver, and your breast is laying in a bath of water and the cameras are going all the way 360 around the breast. And it takes 200,000 times more data points than MRI. Wow. So 200,000 more data points than MRI, which is just so cool. And getting rid of that rate of overdiagnosis is something that I'm just extremely passionate about because I believe that you should only be treating people that really need to be treated with things like chemo and radiation. And that nonetheless, there's also about, 85% false negatives in dense breasts on mammography because with someone that has dense breasts or implants, they look white on a mammogram. And so does an abnormal mass, like a tumor. And with QT, we don't have to worry about that. So it's great for people with dense breasts and implants and creates that really detailed 3D image of the breast tissue that allows us to monitor those changes over time rather than just looking at like a single snapshot.
Wow.
And
so,
go ahead.
Go ahead. Oh, no, actually, I was just curious with the QT imaging. Is this one of the devices that you were saying that like you had to get internationally, like from Europe, or is there, are there other facilities like in the US that also offer this as well? Or is it like kind of few and far between here?
QT actually is from Novato, California, Northern California.
Okay.
So they're a US brand. It was started by Dr. John Clock, invented by Dr. John Clock, who actually
Okay.
also invented the coronary calcium score, if you know what that is
Oh,
for heart disease. And he's an awesome guy. And then the company was sold to Canon. So it has a different name now, but there's about 9 in the US, I believe.
Okay.
And many more are going internationally as well. So they're definitely growing, but it's something that we're
Mm.
really excited to be a part of in the early days.
Oh, that's amazing. So let's say somebody comes in, they do the QT imaging, and then let's say that there is a positive diagnosis. Like, what are kind of like some of the steps that you then end up taking, like with your patients, like from a nutrition perspective and maybe other perspectives, that you're like working on with them as well?
Yes. So if someone does have cancer, we do work with a breast surgeon in the LA area, Dr. Christy Funk, and she's amazing. She also has similar diet and lifestyle that we do. And we also work with them on their diet and lifestyle because even for some
Yeah.
people, depending on what kind of cancer they have, they might just be getting the tumor removed. They might not need to get anything removed, or they might need to do chemo and radiation. So I work with all of these types of patients. And
Mm-hmm.
regardless of the plan, diet and lifestyle is a foundational necessity in treating breast cancer. So we look at their diet, we increase their nutrient density. I use very specific supplements that work
Mm-hmm.
to get rid of any cancer cells remaining if they have a surgery, or even
Mm-hmm.
increase the effectiveness of chemo. And I also use a few different supplements to layer on top of the diet. One of them being a turmeric curcumin from turmeric
Mm.
supplement with EGCG, which is what makes
Yeah.
up 90% of the polyphenols in green tea, along
Mm-hmm.
with a lot of other compounds. And we actually give that to the patient around the clock. It's called spaced dosing. And
Mm-hmm.
you give them one every 5 hours so that cancer really doesn't stand a chance of growing
Yeah.
in the blood. And we do that along with some herbs like Pau Pereira and Rauwolfia vomitora, which are the herbs that help to make chemo more effective and to reduce the
Mm-hmm.
cancer cells that are in the body. What's really cool about these herbs is that they target cancer cells and they leave healthy cells unharmed. Whereas, like, if someone were to get chemotherapy, it targets healthy cells and cancer cells. So you lose both at
Mm-hmm.
the same time. And so the research there has been absolutely amazing. And
Mm.
then we also use a fermented soy product that really helps to modulate the estrogen in the body and to help the patient
Yeah.
heal.
That's amazing. Kind of what you were talking about with the supplements that just reminded me of, so I have a background in like water fasting. I was trained at True North Health Center, which is a world-renowned water fasting facility in Northern California. And again, it's like the beauty of like diet, lifestyle, like targeted supports, fasting, like these things like really help to support and target like the good, healthy cells, and then wanting to support the body in clearing out the bad, unhealthy cells that are, triggering inflammation in the system. So yeah, anyways, just a thought when you were mentioning that was just, I just always love to bring it back to just like sometimes the basics. So out of curiosity, do you ever recommend like intermittent fasting? Now at True North Health Center, we're fasting patients for many, many days, but I'm just curious if that's any part of your regimen.
It always depends on the patient. I do like with fasting, it's better for people to eat an earlier dinner
Yeah.
because you want to go to bed on an empty stomach. And so I do recommend people stop eating by, like between 5 and 6. But it really depends on the person and to see what they can kind of fit in. But if someone is doing chemotherapy, for around their chemotherapy time, when they're getting their actual chemo, I do a fasting mimicking diet of about 500 calories because it helps to reduce the side effects of chemo and to increase the effectiveness. So I do that.
So kind of moving on to other specific, I guess, cases that you work with. So something that you guys talk about on your website is like heart disease and prevention and things like that. So I'd love to kind of dive into like maybe, what are some of the, tactics that you guys are using to help support like any of these patients that are dealing with this?
So most patients come in believing that heart disease is inevitable and are really
I know.
shocked to learn how much control they actually have.
Mm-hmm.
And one thing that I think is so interesting with patients is that they constantly come in with you, saying like, here's my lab work. I'm doomed. I have it. Like, this is my genetic family history. We have high cholesterol in my family. And what I love to share with patients is that traditional lab work isn't even the strongest predictor of heart disease risk. And visceral fat, the fat surrounding your organs, is one of the most powerful indicators, often more telling than cholesterol numbers alone. And that excess body fat, it acts as a metabolically active organ, actually. So it releases inflammatory compounds and hormones that drive insulin resistance. It raises blood pressure, damages the blood vessels, and it creates a condition in the body for heart disease to really progress rapidly. And so I love sharing that with people because this chronic inflammatory signaling that accelerates atherosclerosis and increases the risk of heart attacks and strokes is something you can work on, and that a lower visceral fat burden with moderate cholesterol levels is often safer than high visceral fat with normal cholesterol. And that's why these nutritional strategies that reduce inflammation and improve your endothelial health are really effective. So we always address the same root drivers through nutrition, and we see dramatic improvements. I've seen how powerful the approach can be. We actually had a patient that came to work with my dad immediately after having a heart attack and being advised to undergo triple bypass surgery. He was one of our patients at our old health and wellness center that we used to have here in San Diego. And after adopting a nutritarian lifestyle, he lost weight, he normalized his blood pressure, and improved his cholesterol profile, which are changes that his doctor back at home told him that never could have happened. And all of his numbers were even better than any surgery could ever fix. And he didn't have to undergo triple bypass surgery, he didn't get a stent.
It's amazing.
So that's one of the things that I really love to see. And we've seen people's blood pressure normalize after eating this way within, 1 to 2 weeks when they start our program. So watching people get off of medications has been amazing because the protective benefit that you have, when you lower your blood pressure through drugs is just not the same as having a normal blood pressure through diet and lifestyle. So you can't really compare the two. And I love helping people get off of those drugs and normalizing their numbers and then also protecting their future selves.
That's amazing. I'm really interested to hear now about what you guys do for osteoporosis, because one of the devices that you guys use, and I might be saying it wrong, the Ecolite REMS bone scan. Am I saying that right? Okay, great. I would love to hear about this because I saw on the website, and I've heard you talk about it, how it's better use than the DEXA scan, when the DEXA scan has always been like kind of the gold standard. So I've actually never even heard of this bone scan that you guys are using. So I'm like really intrigued to hear a little bit more about it. Like what makes it different and I guess better utilized than the DEXA scan? And then what are some of like the nutrition approaches you would take for people to focus on even more potentially to support like this diagnosis?
Yeah, definitely. Osteoporosis is a silent disease and causes so many issues for people later in life. So it's something I'm really passionate about screening for. And at Longevity RX, we're really committed to doing 0 screenings that would put your health in harm's way, including annual radiation for any screening text. So no DEXAs, no mammograms, no CAT scans, since ionizing radiation really can increase your risk of cancer and it's just overall bad for your health. So that's one of the reasons when we were doing research on, the state of the art advanced technologies, what we could get at Longevity RX, we found the Ecolite REMS that comes from Italy. And it's a radiation-free, ultrasound-based bone assessment that measures bone density plus bone quality. So what's really cool is that it gives us a fracture risk score and looks at the strength of the bone. So it's actually looking at your internal microarchitecture of the bone, which is a major advantage over the traditional DEXA scans, because not only DEXAs rely on x-rays, it's not very much radiation, but over time that builds up. And, we don't want to screen with anything that's going to put our health in harm's way. So not only does it use radiation, but with a DEXA that looks at bone density, you're assuming that all density within the body in that area is bone. And the more dense it is, the better T-score, better score you have on a DEXA. But you can have other things that are dense, like spinal arthritis, any calcifications, disc degeneration, maybe prior fractures, and that can artificially raise your DEXA. So it's not always accurate. And then with DEXA, you're also supposed to go to the same place and the same technician every single time, because in order to compare it to your last result, it's technician dependent. And what I love about REMS is that it's not looking at just density in the area. So we can control for that. And then it uses technology that if the technician makes an error, it'll just say invalid scan. So it'll never give you a scan that's inaccurate. And the technology controls for that, which is just so cool. And then it also gives us that, as I was saying, the more accurate fracture risk information, which has actually been used in Europe for athletes, because they want to see how prone they are to having fractures in their sport. Wow. And for kids too, that are to see if they're prone to stress fractures or anything that's going to help them as they're aging. So, and it's no radiation, so you can use it in athletes, kids. There's no like injections there. There's no discomfort. And it's just such an amazing scan. I've been loving the Echolight. That was one of my favorite trainings that we did when we got our machines, because I was so impressed with the technology behind it. And you asked about treating osteoporosis too. So that's actually the best part, even with how much I love Echolight REM, is that we got another piece of equipment from Europe, Italy also, and it's called Lympha. And what it does is so it's really simple, no pain, nothing. You either lay on a mat or you use like small little transducers to help with bringing healing cells to the area. So it increases your osteoblasts, which are the bone building cells. And then it also reionizes the channels in your bone to reorganize them. Because when you have osteoporosis, the positive and negative charge within the cells are all out of whack, and you want to reorganize those. So it uses a magnetic field to do so. And we put people on the power plate before we use the lymphotherapy, because adding mechanical stress to the bones before doing that helps to increase the effectiveness of the treatment.
Okay.
It's such an amazing tool. And then we also give them exercises to do, like for people that want to prevent against osteoporosis, you should be doing a lot of like jumping exercises, like running in place, high knees, moving side to side. We go through like a whole exercise plan with them, as well as talking about nutrition, because something like bok choy and kale is really high in calcium. It has been shown to deliver, the perfect amount of calcium you need for bone health. And that's, you can actually absorb, because when you get calcium from things like dairy, you don't actually absorb all the calcium you're taking in. Your bone doesn't take it in. And then we have a food-based calcium supplement, which has vitamin D in it, and it's from algae, actually, from seaweed. And you take a little bit with each meal. So for our osteoporosis patients, we have them take one with every single meal, so that they're just getting a little bit of extra calcium with every meal and not doing so much at once, because an overload of calcium can put calcifications in places we don't want it, like in the heart, or calcification of the joints causing joint pain. So we go, small divided doses taken with meals, which helps to improve absorption and supports the bone utilization, while again reducing that risk of calcium deposits in arteries or joints.
That's amazing. Wow, that's really cool. I actually did not know that about bok choy. That's actually like one of my favorite vegetables.
Me too.
I think I eat that all the time. So actually that's really cool. Amazing. Okay. So kind of still on the topic of like some of the devices that you guys have. So the Immortal Chamber is something I saw you guys talk about. And I also saw you kind of promoting it on your Instagram. And it kind of seems like it's something that really helps to support like stress level, sleep, things like that. So I'm really curious like what this is all about, because, and I guess like, is this utilized in other parts of the US as well? Because I'm always looking for like new supports for a lot of my clients, because again, I'm working with so many clients under toxic burden that naturally their nervous systems are in just such a disarray. And so being able to anything to help kind of support the nervous system, aside from like daily nervous system practices you can do at home, I'm always looking for new tools. So I'm so excited to hear about this.
Yeah, I love that you say that and that you help people with toxic burden. What you do is just so amazing because it's something that I've
Thank
undergone
you.
in my life is being sensitive
Hmm.
to environmental toxins. I had really bad like mold sensitivity and sick building
Hmm.
syndrome. And it was really detrimental. Like anytime I,
Yeah.
go to a hotel, I feel sick and I have to find a new one. Like it's a crazy just
Hmm.
experience to do. So I love what you do. And
Thank
I'm so
you.
passionate about finding things to, make the body more resilient to
Yeah.
toxins. And the immortal chamber is something I do many, many times a week. And it's one of my favorite technologies. What it does is it combines four different therapies within one. So it has a full body red light, and that's really good to reduce inflammation. It
Hmm.
has pulsed electromagnetic therapy, which is the
Oh,
PEMF
nice.
therapy.
Hmm.
And with PEMF, it's like a recharge for your cells. So it's kind of like how we charge our phones, we're charging our cells, and it helps people to be more resilient to environmental toxins. And then it does vibroacoustic stimulation and guided meditation. So it does some breath work in the beginning. Throughout the session, you're listening to nice sound therapy with vibroacoustics. And then the last thing that it does is molecular hydrogen. So you wear a nasal piece and you're inhaling hydrogen throughout the session, which is a really potent antioxidant.
Mm.
And just when you leave the chamber, you feel so relaxed. The goal is really to shift people out of chronic stress mode and
Hmm.
into repair mode. It's a healing like meditation with extra bonuses that are amazing for your skin. And one thing that I'm really passionate about with, patients who have chronic toxic burden is that they need to do things to increase their vagal nerve tone because a lot of people will have issues with their vagus nerve, meaning it's like
Yeah.
it's just underactivated and they're,
Hmm.
constantly in fight or flight. They can't be in rest and digest. And
Yeah.
so this technology is really great for that. Along with some other
That's
things that I do with
amazing.
my patients, but this technology
Hmm.
alone is so cool and it's relatively new in the US. So they're popping up.
Okay.
They've been going to a lot of different conferences and trying to become more popular, but it's used really by elite athletes and high performance wellness centers.
Oh.
So we've been seeing it used as just like a powerful adjunct for stress reduction, controlling inflammation, sleep, overall longevity. Really, really cool machine.
That's amazing. So how long is like a typical session like that someone would that and so how long is a session and then how often like might somebody like want to use it? I guess is it similar to like a sauna where it's like infrared sauna where it's like the more you do it the better or like
Yeah.
yeah.
The more you do it, the better. I
Yeah.
recommend people do it, three
Figured.
times a week, like every other
Okay.
day, or, it's one of those things again where the more you do it, the better. But I typically recommend between like 2 to 5 times a week.
Great.
And it's what was your other question?
Oh, like how long are the sessions
Oh,
in
how
it?
long
Like
are the
how long are you
sessions?
laying on it?
Yes, it
Yeah.
is either 25-minute sessions or 50-minute sessions. So
Okay.
you can do either one. I
Awesome.
was a little intimidated to do a 50-minute session because I just started a business. I'm like very go, go, go personality. I
Yeah.
can't like meditate for that long. But I was
Right.
shocked. Like I actually felt like compared to the 25-minute session, the 50-minute session, I left like my face felt tighter, my body felt better. It was like really, really cool. But 25
Wow.
minutes I would say is like the sweet spot.
That's very cool. Wow, that's amazing. So, kind of going back to what you were talking about earlier, like how you yourself went through, mold illness and, sensitivities to different environmental toxins and air quality and things like that. Something I was noticing as you were doing the, construction of Longevity RX building was that you were very like that you emphasize the importance of making sure that the materials that were being used were good. That I saw that you're using like a very specific type of like air purification system. So I'd love to kind of just hear a little bit about that side of things because that is so important. It's so unfortunate that so many buildings now in America have water damage and that a lot of it tends to be like hospitals and like doctors buildings and things like that where like we're supposed to go to get better hopefully and we're getting exposed to mold. So I would love to hear a little bit about like the construction side of things.
Yeah, that was really interesting because in finding a place for me, since I am so sensitive to buildings, I was like, I have to be able to go there. Like the worst thing for the business is if
Yeah.
I can't show up. So I
Very
need
true.
to find somewhere that was like perfect for me. And I found an interior designer that was really aligned with what I love. And she used all natural materials. So everything in Longevity RX is natural. The stone behind me is Longevity RX stone that's natural. We use lime wash paint on our walls, which is mold resistant. I did get a mold inspection when we were doing construction, and found that our HVAC system was a little bit moldy. And that's probably why I was not feeling well when we first leased the space. And so we got a whole new HVAC system, and I use a really high grade HEPA filter within the HVAC system along with UV light. And then we have air purifiers all over Longevity RX in addition to the HVAC on our walls. And we have a sign actually up front that says like our air quality is even better than outside. And one of the system that we use is called IQ Air. And one thing that I thought was so cool when we found out about IQ Air is that they use medical grade hyper HEPA filtration. So it's independently tested to capture particles as small as like 0.003 microns, which is much smaller than what standard HEPA filters are required to capture. So a standard HEPA filter, I think, is like 0.3, and this is 0.003. It's something like that. And so it can effectively remove like ultra fine particles, things like, down to like wildfire smoke, any like airborne pollutants. For me, I was really looking for mold and stuff like that. So I'm really, air quality is something that's really important to me. And I love the system we've set up in Longevity RX, because I'm like, if I feel good, I know we have good air quality.
Everyone else will.
I'm so sensitive. But yeah, one thing that like in my experience is having my experience with what I went through, it's just been really helpful to help other patients, because we talked about a little bit before about like increasing fixing the nervous system response. And these patients really do have a heightened stress response that can amplify symptoms. And of course, you have to remove what's causing the issue. Like environmental toxins are terrible for a bunch of reasons. But some people are more sensitive to others. Like, why could I not go into a building that my fiance could go into? And so I've realized that working on vagal tone and calming the nervous system, using tools like the Immortal Chamber, like biofeedback, breath work, and even simple practices like humming. One thing that my fiance and I will do to really help my vagal tone is we'll take turns humming a song, and the other person has to guess what song we're humming, because it can really help to calm down your vagus nerve and also be fun at the same time. So just supporting the nervous system become more resilient has been really important and really helpful. And then I touched on this a little bit in the beginning, is the omega-3 index. I do test omega-3 index in all of my patients that purchase a longevity package with us, which is all of our screening techniques, consultations with me, lab review with me. And so I always test the omega-3 index, because it really shows us how your body's detoxing properly and if you can detox properly. And then we also do an advanced lab panel that looks at DNA methylation patterns, and I can see toxins in there as well. So I'm looking at PFAs, which are called, forever chemicals. Those can be like in cookware, food packaging, cosmetics, even carpets. But I find for most people, it's pots and pans. We look for that. We look for pesticides and just a bunch of other things to help people.
I love that you touched on that, because like we were kind of talking about off air too, but it's just like toxins, like we just live in an increasingly environmentally polluted world now. And so that they're just everywhere. And so again, it's so important to like be aware of that, and then be able to test for that and identify like what it is that person might be dealing with to help remove the stress response. But again, the nervous system that I have found like time and time again, like through my own work in this journey, like through my own personal journey, but also through working with like so many clients on this, is like, we got to get the body to feel safe again too. And like, how can we heal if we don't feel safe? And so I love that that's a big part of what you're talking about with your clients, is like the vagal toning piece and getting the limbic system and everything to feel safe in the body again, because that's like such an important piece. So that's amazing. Is there anything else that we didn't talk about that you wanted to discuss, like regarding Longevity RX? Did I not cover any specific like conditions or maybe tools that you guys are using?
Let me think. Well, one tool actually that I didn't mention that's really cool is we have like a liquid biopsy, I like to call it, where you can test for, it's actually a test for over 66 different types of cancer based on blood work. And you're looking for a protein that is like an early detection cancer marker. And why I love that lab so much and why we include it in our longevity package is because if you do have a protein that can detect cancer really early in the blood, it's before the human eye can detect it. And in that situation, diet and lifestyle could be the only therapy, and is extremely, extremely, extremely successful at reversing that marker. And I just love doing that lab in addition to a bunch of other advanced panels with people to, again, use that as like, we can see people actually aging in reverse and removing cancer markers. And it's really cool. Like the lab I was telling you about that looks for toxins also gives you a chronological age versus a biological age. And that one's just fun. So seeing people actually age backwards has been so cool.
I'm sure they love seeing that too. Yeah. They're like, yay. Oh, that's very amazing. Wow. I love that. So would love to then just kind of let you tell the audience, like, where can they find you, work with you, or, social media, all that stuff. And then do you guys offer telehealth like supports at all for like nutrition consults or anything like that?
Yes. So I'm on Instagram at Dr. Cara Fuhrman. It's just DrCaraFuhrman. And then we also have an Instagram for Longevity RX, which is LongevityRx_. And so anyone can also go to our website, which is drlongevityrx.com. And that's drlongevityrx.com. And we do offer in-person care as well as telehealth consultations, depending on the person's needs. And I also do share a lot of educational content on Instagram where I talk about nutrition, women's health, longevity science, and prevention-focused medicine. So you can find me all of those places. And I just love to meet people. And what I love most is truly connecting with my patients and practicing in medicine in a way that's rooted in care, education, and trust. Yeah. And my goal is always to help people integrate healthy practices into their lives while reminding them that they have options and that knowledge is power, even in medicine. Even for people who don't work in medicine, they can still be knowledgeable and take their health into their own hands. So I love that.
No, powerful words. Well, thank you, Dr. Fuhrman, for joining me today. This was such an exciting episode. I loved learning all the different tools and resources that you guys have there. And I know everyone's going to love this episode too. So thanks for being a guest.
Thanks for having me. It's so fun.